The medical procedures aims to determining, testing, diagnosing, and treatment delivery. Today we are going to discuss about the medical procedure that is commonly used in the medical practice. The medical procedures are roughly divided to be propedeutic procedure, such as medical observation, auscultation, palpation, and percussion. The vital sign measurement is a very good example for the propedeutic procedure, like blood pressure, measuring the body temperature, are also the medical procedures for assisting the final diagnosis. Diagnostic procedure is procedures to find or confirm the clinical diagnosis, such as electrocardiogram, ultrasonography, or ultrasound. The treatment procedure are the medical procedure for treatment such as surgery, for example, mastectomy, thyroidectomy, and the others like anesthetic procedure, and so on. This lecture may not cover all of those groups mentioned above, but you will have the reading material with this lecture for further study. This slide shows the example of the common use diagnostic procedure that you may have heard before. X-ray, such as chest X-ray. The scalpel is the X-ray to study the scalp bone. The fluoroscopy, using very low-dose radiography to monitor part of the body in the real-time function, especially in the digestive system, urinary system. It is usually used the contrast media, such as GI follow-through study. Angiography is also one study that uses a fluoroscopy technique to study the blood vessel, and ultrasonography. So many new technologies evolving in medicine. There are so many upcoming diagnostic procedures. For instance, computed tomography or CT scan, magnetic resonance imaging or MRI, magnetic resonance angiogram or MRA, positron emission tomography or PET scan, the nuclear medicine, for example, thyroid scan or bone scan. The PET scan is using to detect and measure the metabolic function of the organ. The general surgery can be grouped as curative surgery for treatment, for example, cholecystectomy, hysterectomy. The restorative surgery to improve the function, such as the knee replacement surgery. The palliative surgery aims just to relieve symptoms like colostomy, to release the waste product out of the human body. And the diagnostic surgery for finding the cause of the diseases, such as biopsy. There are words that you may need to get familiar in the general surgery field. Laparotomy, the large incision through the abdominal wall to gain access into the abdominal cavity. The laparoscopic is a surgery used instrument to examine or operate inside of the body cavity, not widely opened the body like laparotomy. The cryosurgery is the operation exposing tissue to the extremely cold to produce a cell injury or tissue destruction. And the laser surgery. This slide reviews some more common words related to surgery, like resection, means cut or remove, incision and drainage, repair, transplant, the fine needle inspiration, fasciotomy, herniorrhaphy. I also would like to say that reviewing this suffix like ostomy, ectomy, raphy, pexy, plasty, opsy, and synthesis will help you to identify or analyze the medical word related to surgery. As I mentioned earlier that this lecture may not be able to cover all of the interventions in medical practice, but almost all of them were included in the study handout or reading material given. The next couple of slides will review some procedure by organ system such as female reproductive system, digestive system, cardiovascular system, and nervous system. You may notice that the suffix tell the state of the procedure, how it done. In this slide, ectomy means remove. Scopy means scope or looking. So if you have a look at hysterectomy, it means removal of uterus. Oophorectomy means the removal of ovary. Pelviscopy, using endoscope for diagnosis or treatment of the female reproductive organs. Dilatation and curettage is one word, just to remember. The example of digestive system related procedures. Again, you may notice that suffix modify the meaning of words. Some eponym like using Stegen-Blackmore tube is mentioned here. The cardiovascular system related medical procedures are shown in this slide. Electrocardiogram, echocardiogram, cardiopulmonary resuscitation or CPR, transcutaneous pacing, coronary artery bypass graft or cardiac shunt, peritoneal coronary intervention, and AV shunt for patients with chronic renal disease for hemodialysis. There are some of the common procedures related to nervous system such as craniotomy, means opening the skull to access to brain, since tomy means open to access. Craniectomy, since ectomy means cut off or remove, so you may be able to get the meaning of this word. The photo related to words like burr hole, lumbar puncture are in the following slide. This slide demonstrates the procedure like burr hole, lumbar puncture, the VP shunt, which is the procedure to place the drainage tube to drain cerebrospinal fluid from ventricle to peritoneal spaces. That is why it is called V flow to P. It is a palliative treatment for the obstruction of the flow of cerebrospinal fluid. You may need to go back to review the body spaces in order to see what the peritoneal space is. As I have mentioned earlier, there are too many medical procedures involved in the medical fields. It's very hard to cover every single of them in one lecture sessions. But anyway, you have the reading material given along with this lecture. Please spend time reviewing it and finish the quiz. Any question or suggestion, please contact me. Thank you.